So there's a bit of, for me, my understanding, it looks like there's a bit of disconnect.
Sure. No. So the problem that arises here is we're in the system of DHB-driven access to service. Okay, so each area across New Zealand traditionally has had different pathways to access care, either through paediatric camps. A whole lot of different things occur. So there's no national consistency in terms of where you access specialist care. Most kids where a problem is flagged about potential autism, I think the job of the GP is start to reflect back and listen to the parents. Obviously they've got concerns. To look at the situation that's going on in the child and ask the question, yes, is specialist intervention required here, which obviously is with autism, and to access the pathway to get that specialist intervention across New Zealand. One of the comments I'd make about that, though, what we have seen and what's become really apparent, there is a huge amount of pressure on those services to do those initial assessments and to look at intervention or support that's required for a child with autism. So the GP's role in many cases is to acknowledge the parent, any concerns that are there, to do the initial assessment, then to advocate or push through to the pathway that is available to them within their local region.
Given that, is it not potentially possible for GP to have an assessment about autism? And I understand that the HBs are currently under the pump and very busy, and there's this huge waiting list. And for me as a parent, I feel like we're missing the boat on getting the support that these kids need or require. My question is there a potential avenue that our GP can do an assessment about autism, and perhaps that can be considered by the HBs as well?
Yeah, look, I mean, in an ideal world, a potential issue that is identified by a family or a parent, I think is an absolute positive and should be trialled.
And then what's the process in that? Can we just reach out to the college for that, just in case they get the funding that they are asking for?
Well, if they get the funding for it, they'd then go through a process of looking at the best way of doing it.
Right.
So you either do that, the college is one avenue of starting to say, could you do that? The other avenue is what's called PHOs, or primary healthcare organisations, are often involved in this type of study, so you can take a particular area. For instance, ACC is doing one at the moment into concussion treatments, right? And they've got two areas in Christchurch and Auckland where they're running out standardised approach to concussion for children, okay? And so they're trialling that over a year in these particular areas to see if it's got national validity in terms of its use. Its utility, can it be used, and how effective is it, and does it actually move the whole system forward in terms of the treatment of concussion across the country. So that's the type of thing that's often done in these situations. Yeah.
Okay. And then you did mention about the practice or practices, and are we also preparing the practices in terms of the environment? For example, I know that it's not yet that huge in terms of the numbers of going to practices like autistic people who are not, for example, not acquaintable with noises and things like that. Is it something that we are looking at as well?
Things I would say, we've got 1,000 practices across New Zealand, right? We've got 5,500 GPs working within those practices. We've got about 10,000 nurses. It's a very, very large sector. We have about 80,000 consults a day. We have about 20.5 million consultations a year. Yeah, and that becomes a really important part of what goes on.
Yeah. If the parent would say no for that side effect, I mean, like, let's say a parent heard a side effect that she doesn't want, can they say no, or is there a recommendation?
No one can force you to take the medication. So look, what happens in conversations around this, and my experience with this, you often with medication, you sort of get a feel as the doctor that there will be benefit if you go on that medication, okay?
Right.
So my job as a GP in those situations is to be very clear about the benefit, but also with side effects and things, not to overdo side effects, so I can sit here and list the 101 side effects that may be on what we call a data sheet, okay?
Yeah.
That really doesn't help,
right?
Because in many cases, they won't occur, and they're very minor, and it's just raises anxiety, okay? So I'll often talk about the major issues that could arise. I also tend to put it in perspective that this issue would arise in 1 in 100 children, so we need to be clear on that. And, you know, if it does, contact me, we'll have a chat about it, or see me and we'll see about it. And because we often find that side effects settle down after a period of time. And also I leave it open that if there's anything else they notice that they're concerned about, to talk to me about it, so we can discuss it and see whether it's related to the medication or not, and be very honest about that. But you've got to weigh that up with the benefits of doing medication. The only reason for doing medication is if there's going to be a benefit.
Right.
Otherwise, don't do it.
Yeah,
there's no point.
Yeah. Just like taking something that would hurt someone.
Well, exactly right. There's no point in doing that. Yeah.
I mean, Takiwātanga is a Maori term for autism, and this is the term that I've been using ever since. And I've heard about Te Reo Hapai, which is using, it's a glossary term used for mental health, disability, and addiction. And these are Maori terms, English terms to Maori terminology. Is it something that we can perhaps, not too much to ask, but is it something that we can perhaps start using?
Okay, look, that's a really good question. I think there's two ways I'd answer this, and it's actually really important. Number one, just going back to the college and training for GPs.
Right.
Okay. Māori approach, cultural appropriateness. I mean, we should never see rheumatic fever.
Yeah.
It is a total sign of inequitable outcome in this country. So that requires a social determinants for health approach, which is housing, education, a whole lot of things, access to medical care, access to quality medical care, which is something the college is really sort of strong on, and access to quality, culturally appropriate care.
Right.
Okay, and those things need to start to line up, and that requires resourcing, both at a government level, to Whānau Ora Health New Zealand, and at the practice level as well.
Right, and then you mentioned about government. The college is just working currently with MCNZ, right? Not directly to the Ministry of Health New Zealand, is it?
No, the college has a lot of contact with Health New Zealand, a huge amount. Yeah.
So it's not just the one sector.
No. So we spend a lot of time in meetings and talking to Health New Zealand about issues. However, the issues with Health New Zealand are large. I'm hope that it takes our whole system forward.
Yeah.
And also the Māori Health Authority, but which again the Māori Health Authority has been set up under the treaty obligations, but also as a vehicle for looking at, and specifically looking at, disparity with Māori versus other Europeans, especially in New Zealand, and what can be done in that space.
What is autism in the eyes of Bryan?
It is a condition that is absolutely real.